You are watching Liberty Online TV.
This is Liberty Online TV powered by Orange Sierra Leone. Orange.
We look for the news with the around. Log into Liberty TV online. Positively we bring the change. They get the masses involved. Staffs them everywhere, everywhere. We climb the mountain just to get the news. We go down the slums to get the views. Hi, yeah, hey. Voices come. Hi, yeah, hey. Credibility, now we ability. News, give you the views, the tell where you want them. Government issues, democracy, now we not the answer. We human them, girl picking, there's a get the power. He count on me, he count on me anyhow. Give you the news, give you the views, the tell where you want them. Government issues, democracy, now we not the answer. Human them, girl begin the security power. We keep calling me, count on me anyhow. Liberty we ride, like a nigga we fly. Liberty TV day before. Climb the mountain just to get the news.
Good evening and welcome to another edition of Unscripted with Liberty Online TV and Mina Ajasun Karisise, aka Adri. Wanna welcome as this now another edition, and today we get a very interesting discussion with the all in the studio. Like all the time, we get somebody we get for help we follow able breakdown or everything we get for can put on the table today. Everything we talk about, we get somebody where they help we for lay people and better understand. So today we discuss female reproductive health. As we know, we women there, we very, very sensitive from menstruation, pregnancy, hormonal changes, and a whole lot way concerning women. We are very, very delicate being them. And we get so much to we reproductive health, we a whole lot of we don't understand. Some people then do while something can shy away from forgetting discussions there. But it's very much helpful as then discussions there. So then for the educate we, for let we know bokuts in the way we don't know. Now when you get the knowledge about something, now you know how to go about them. So when I stay with we on this journey so as we get for touch every side, like every single details, and anything where you're confused about or you get concerned about or you want to know about when it comes to female reproductive health, just go ahead and type in the comment section. We guess go help on and try for break down anything where you say you want to know. So today at the studio it's me. I got a doctor and he's a gynecologist, so you know what that means. So that the studio help we introduce Dr. Jallo. Okay, say hi to viewers.
Viewers, good evening.
Mm-hmm.
We are Dr. David Jallo. We are specialist obstetrician gynecologist.
Okay. So doctor, how long you done the practice so far? Because I believe for lay people, for you get to that point, it takes a lot of training you get.
Okay.
So yeah.
So I done the practice for over 15 years now.
Okay.
From the time where I done my first degree in medicine. Then after that, I got specialized. Because when you don't do medicine, be a house officer, medical officer, from medical officer, then you can go specialize in the field where you want. So it's over 15 years now.
Nice. So when we talk about female reproductive health, I believe it entails a whole lot. Like I said, no more we women there, we very delicate, but we'll take on like step by step. So,
Okay.
yeah. So our we start with first Okay, what are some of the things there as a gynae where with your experience with woman there, whether you can feel shy for talk about those stats and that first?
Well, before we are going that first, probably let me just describe what is the female reproductive system. You understand? It good for make the viewers them and the woman know then are husband and know exactly.
Right.
So basically, the female reproductive system is made up of specific organ that will make a system. So you get what with the inside, only they see, they get what the outside. So the whole day inside, you get the ovaries. That ovary then are very important. Maybe we can go down there about the ovary. The ovary now make a woman because now they produce some hormones them, estradiol, progesterone, and so on. So that the woman will be waiting for be as a woman. Then you get the fallopian tube, you get the uterus, you get the cervix. Then you get the external one. That's the internal one I don't name so. The external one, you get a whole set of what we call the vulva. The vulva make up of one side they call mons pubis. Well, family na sorry because the time they be big. But the mons pubis basically now like some 3D along near your pubic bone. Then you get the labia majora, when are the lip of the vagina. You get the outer one, then you get the inner one, the labia minora. Then you get, of course, the clitoris, where they right up between which side the two labia minora they connect. You get the clitoris. Now, very sensitive organs the way woman get. And then you get the opening. Then you get all that thing like battling gland. Now they don't see them pass somebody tracing in this. So that's not the external part. So now this now the reproductive system of a woman.
Okay.
So we're coming to what you ask me, say, what is the thing the woman is almost shy for share with. Well, based on the woman, because the reproductive system itself, basically, they get job what they do. So one of them job then they for any woman we don't reach minaki, which side for mess, it a mess because now that organ is 90 for that one day. Then two, a day for waiting for conception. Woman they get belly or take care of the pikin, you know. So also for sexual intercourse. So if you not perform those functions in a good way, or in a way basically where other things that happen to the woman, then that can make her health not look too fine. So some of the things then back with the woman can say sometimes some can be shy for tell you, sometimes they get infection. Sometimes they go shy for tell you. But at least most women they can get the infection there. Some go want to treat themselves now stay. It's only way people don't able to treat it, then they can see a gynecologist say, hey, doctor, I don't get this problem here. So now some of the things that where they can shy for tell you. For say I don't get infection. Because infection, most of the time someone get infection, waiting somebody thinks say something you don't go sexually. You understand?
Yeah.
So not to all infection are sexually transmitted.
Exactly.
So all that thing they where they make you get infection. Either probably your hygiene, or something you do to call douching, where they take care, they put your hand inside yourself, then thing. Or probably the way something you go down the whole day, you work something like underwear, you did it for all day, then it will become humid as the case may be. So that can give infection. So not only they per sex, but as I say, most of the issues them, we then get infection for tell you, say doctor, I get infection.
That is shame.
Yeah, exactly.
Wow, yeah, I'm not surprised because nothing we I feel like in common. Some even for share with them fellow woman then will feel somehow. Just think about maybe say now male guy need them to talk to.
Yeah.
Okay, so when we talk about menstruation, so a whole lot of people then can talk about the pain where they come with. For myself, even from your experience, I'm not sure say any gal picking there around me, we not they complain menstrual pain. Or people then can say if the pain too severe, then maybe not to menstruation, then I get wary about this thing called endometriosis. So I will make you like share light around that for me.
Okay. So let's talk about menstruation before we go to endometriosis.
Sure.
Because when you talk about menstruation, like a monthly cycle, a monthly event that happen to anyone. It get phases them. Most women, before it happen to them, you get a lot of things. Some them they begin feel sometimes they bobby them, they look flop.
Sure.
Sometimes you begin get some small bottom belly pain. So menstruation, as you say, normally it's not all cases say when they mess, you go mess feel without pain.
Okay.
it depends if you get some problem, underlying problem. So we can call it normally painful messes, what they call dysmenorrhea. But it can be a primary cause, it can be a secondary cause of pain.
Okay.
So if na primary, na one day not born it. And you not get no underlying problem where they don't diagnose it now because of so thing we did it, that make the pain in the monogram. So that could be just exaggeration of the hormonal system. Because when they mess, as I say, they get phases then. So one of the phases then where woman can able to know about is where they see the blood is slough out to the vagina where they come out. So that the menstrual phase that one day. But it gets phases then when a follicular, secretory, luteal, before you see what will happen. So that slough in the primary sense, woman can get pain, not just exaggeration of the hormone system. Because what will happen, the blood supply at the uterus, that layer there, it can be so, it becomes so small, short away that the woman they get pain in the primary amenorrhea, but no cause no day for saying that this particular thing make. Now just because of the hormonal system. Okay. Then the secondary what they happen, this now the one problem somebody don't born, there's probably get some other pathology then like say, other problem, the sickness like say, pelvic inflammatory disease. Then na sequence until the woman they get abnormal discharge. Okay. You know, starting bottom belly they had, they can get fever, now kick up PID. Or it can be something they get fibroid. It can be something, this thing you just call endometriosis, we can talk about. But Lord just take for the message so that family can understand.
Step by step.
Yes. It can be what we call adenomyosis. It can be something because woman gets cyst. Cyst is something where it forms collection of fluid or water na the ovary. So in that sense, when they mess, because of that exaggeration of that hormonal system, they get pain. So now that can happen. So it can be a primary or a secondary. Okay. The secondary, now when you get some problem I don't just mention, so now I tell you get the pain them. So when it comes to the endometriosis is that, well, what did happen with endometriosis? Because we all know say the uterus line actually the shed off the lining of the uterus
during menstruation.
During menstruation, exactly. Okay. So what can happen is that you can get tissues them. We get that same kind endometrial tissue where then there's some certain area there. We're not to the uterus.
Forget like words the way. Forget for break.
All right, I got
some people like go there like just some certain words they like what they call words that they don't get to understand. Right. I don't know if we able get like mild words there, you know.
I will break it down. Okay. So some things and the lining of that uterus we can shed off, not to the uterus no kide. Okay. Kide other side them. Kide something at the ovary. Sometimes some other aspect of the body within the woman in reproductive organ, but not to that line in there for the kidney. So when the woman they mess, then say they respond to the hormonal changes. In short way that mess they what they see when they come out to the lining of the uterus. In the young case, they come out, it's just they say today. Okay. So just imagine like you get gutter it need for flow with water. Then probably a block somewhere. What did happen? It overflow. Exactly. You understand? So now the same thing where the lining they slough off, it not get time for come out. So in that sense, it gets serious pain. What they call endometriosis.
Okay, I think then you don't break it down. All right. Yeah, it makes so much sense now. Okay, I understand that now. Okay, so now that way they
exactly. So now they call endometriosis. So some woman they when they get menstrual pain, it can be as a result of what endometriosis.
Okay. But let's say in the case for people the way they're not born it before, just young people the way they get excruciating pain, they like whenever they get the menses, then they can complain some kind of pain, back pain, waist bone pain, instances like that. So I not say the best thing I forgot in hospital, but other people, some people tend for diagnose themselves. They talk say maybe this not so ordinary menstruation pain, this not this condition, yeah. So now let me see if I even ask that question.
Okay, the condition of endometriosis.
Sure.
Well, yes, it can happen. It can happen because, well, I want break and down the way people don't understand.
Exactly.
Well, you get where this line here can go other side other than the lining of the uterus. Well, that cavity of the uterus. So because anytime woman they mess, not to all the messes they come out now do. There's tendency say some theory the way they don't put say some they backflow. They go back now the tube, go back other area them, and then they begin for go. So that when they other tell the woman the same period, then say they respond to hormonal changes. Now one theory that what they put. Other theory they don't put is just like that immune response normal what they happen inside the woman. In a way that it just like create that pain there, what they call endometriosis.
Okay, so I want to ask this question. How you go describe irregular period? Like when somebody they say me period is not regular, how you go describe that this so?
Okay, so first of all, the duration of the period for any woman is for be between 2 to 7 days.
Okay.
If your period is below 2 days, then they abnormal menses. If it's above 7 days, na abnormal menses stand. Then the cycle itself, when you see period today, how many days it take before you see them back? If for day between 21 to 28 days. But now it don't change.
Okay.
Not only 21 to 28 days for see them back. It can be between 21 to 35 days. At even 38 days. So if you don't see period, you for see them. So anytime you see a period below 21 days, na abnormal menses that one day.
Okay.
You understand? Reason the way they cause that one day. You menses for come after every 21 days. If it come below 21 days, it's abnormal. If it come above 38 days, na abnormal menses down the back. Because if you see them within that period.
Okay. So then like we possibly say me period irregular and I think then people need to look out for.
Yeah, exactly.
Okay, so when you mention the cycle, so the menstrual cycle, I don't know, I feel like people even at schools them, especially schools that we get girl picking and girls schools that the need for the shed more light on issues that like this. So I recall at some point then they go school. So the teacher be talk about a cycle, and I think I'm economics, so I'm able to remember the subject anyways. But it say like where they explain no more. Where you get a period, 5 days or 6 days after a period, it talk about safe periods. Okay, if I able recall clearly say it talks say after a period you check like 10 days. And that 10 days the 9 is safe period. So like where would they go to school now? We don't get the idea the 90 now 8. So me now be the advice me company or girl picking around myself say after a period you get 10 days as a safe period. Until we get to a point now understand say no, not to that way it work. I'll tell you say okay when you done 5 days or 6 days you can check now 1, 2 to 10. That period all is safe. Beyond than a wrong information. Now be they even give out.
Yeah, it's wrong actually because it depends on the frequency of your cycle.
Exactly.
So if your cycle they come after every 28 days, then in that case that mathematics will be correct.
Okay.
But nothing is 100% always certain.
For
so you have to be very careful.
Right.
Yeah. So if now 28 days will they take, say you cycle they carry 28 days. So let me say you period day for 3 days or 4 days. So most time the rule of 7 they come into play. So after 7 days from a menstrual cycle, now you're on safe period. But not just count based on that 7 days. They look at other features that happen to you. Because in that after that 7 days, you for the ovulate. Yeah. And the signs of ovulation, one per woman, is the desire for get man business.
Okay.
Then what did happen? They get slight bottom belly pain. Because what did happen in that sense, they hate the left, the ovary, for count towards the fallopian tube.
Okay.
Because that specific area they also fertilization will take place. So now some of them say you see, then you can see they get some small changes in the woman. Small changes they make. It first they look like a oily. But these are all things we see. But they are not definitive.
It depends on the person.
Exactly. They are not definitive because sometimes somebody go and say, well, they go take with the doctor, don't see so. You understand?
You know, it's in I want to make mention. So when you don't talk about this ovulation and pain, I want to say something. I know say a whole lot of people can focus on menstrual pain and you talk about slight pain. But at this point nowadays, so I feel like for me own experience, ovulation pain to me is not slight. I feel like even it's more serious than menstrual pain at this point in my life. And the experience. So whenever I come or we talk about this thing, some people go say like ovulation pain, that is a thing because I feel like, say we all body different. Some people they experience something like that.
Yeah.
But when you talk about slight pain, like what's me the experience? It's not slight.
Okay. So it can differ because nothing actually not fixed. Because even human being can differ from one person to another person. The symptom they get, not the symptom they get.
Exactly.
And when you count on pain you go quantify am based on the individual. But actually, not a pain way for be like where you want to see your period. And they come at a time where you know they even remember for see your period. So I don't know if some people they actually patient don't say, doctor, why do they say they pain too much? So you can just say what to take paracetamol.
Okay.
You understand? So based on what you does, so not even again. But actually, majority the pain not too severe, now just slight pain.
So if the pain is severe now,
well,
now why the pain is severe?
Well, probably what you can do, you can family investigate, better and see. Maybe you get on the line the other thing them where they happen to you, where need for be known.
Wow. So
Yes.
anybody they experience things like that, they say
We go do a
maybe you
scan
get
and
underlying issues. Wow.
You go do a scan and see what is happening. Is there a cyst? Is there something where probably they irritate them? So you need to find out and know what to make. But enough for be a severe pain too much. But people they get severe pain.
Yeah, because somebody don't share experience with me say when it ovulates, the pain can be so severe it even get like a slight blood.
Well, enough for be blood actually. What did they happen? They get some form of discharge. Where they come
Enough of the blood.
Enough for be blood, basically.
Okay.
Except probably it gets some injury within the cervix or the vaginal wall.
Okay.
Or you get a polyp, something where they go, where they shed blood. But the thing for common, a discharge will look white and thick. So if another way down the we can no serious, and they ovulate.
Okay.
Apart from the bottom belly pain, where they happen, and even the desire for sex. But other thing then they also you can do, then get other test them. Urine test kit. You understand? They call some like clear blue. It able show you, say, it ovulate.
Okay.
Yes. But the definitive diagnosis basically is now when they take tissue inside uterus, they see the type of cell. Because during that time, the cell structure, now the line of your, they change. Because in preparation, say this one they can't get belly for receive the picking. You understand?
Now, who's testing, who's test, so we go determine the thing and the purpose. Like who's testing, who's test the way woman them for do. I can hear about this old pap smear test. I don't know how that particular
well,
one.
no, pap smear are different tests. Pap smear basically a screening test we do for somebody for rule out cervical cancer.
Okay.
We do. So now something you can do from the age of 21 years till 60. You can pass menopause say you do it, but if you don't, they do it regularly. So that's quite different test that one day. Okay. That test they indifferent. You can do hormonal test them basically, but you see now narrow window. So you can go do the hormone test until the tendon pass. You understand? So do your ovulation because what did happen? There is a peak in one hormone, what they call LH. The peak for allow that egg for come out. So at times if you do LH, you go still take it up. But other tests, other thing and the hormone and they also they contribute. So not just the LH number they contribute, LH surge. Other hormone and they also they contribute. But based on also the signs the way they see. Because some of them when they show you that sign they, as I mentioned, that small bottom belly pre they get, that thick white discharge we they get, and even you desire for my business can increase. Because it's something like say, I'm expecting. Because the body said they tell you say, you know, because it's natural say a woman within the reproductive age group forget better. So it's just like a physiological process will take place.
All right. Okay. I feel like we don't shed light on that day, and I feel like it's clear. Myself don't understand a whole lot of things there. So, okay, let me talk about. Okay, we don't talk about menstruation. So let me move to pregnancy. But before that, Seth, I want for let's talk about hormones then first in woman then how then they change stuff like that. They know the hormones then.
Well, woman then get plenty of hormone.
Okay.
Well, yes, but it might also get hormone. You understand? Starting with the thyroid hormone. Now a very important hormone because now they control all metabolic activity in your body.
Okay.
Whether now your heart, how they work. Because your organ for made them work fine one. The thyroid hormone get forwarding, control the metabolic activity. You understand? Because now they're able for help. If you not eat good food, you know they get some nutrients for made the organ and work. So thyroid hormone they play a very important role for a woman. So it's a woman that they see in period until they see more than 7 days, they say I'm below 2 days, or you need to say at all, you get for check the thyroid hormone and see what will happen. They got a hormone called prolactin. That hormone dey basically woman get belly or we don't born. Now you're responsible for production of milk. So if it happen to a woman we not get belly it, for some reason, milk they come up by Bobby. That's abnormal. That's not good at all. But now coming out to the hormone and system, the other one and the estrogen and progesterone. Yeah, we take reproductive. Yeah. So the estrogen and progesterone, they play a very important role.
Okay.
So the estrogen get a role because where woman don't reach the reproductive age group, the ovaries they produce egg every now and then. In fact, for me you see your period, eggs and could not be recruited for that particular phase of that menstrual cycle. So you get a process of recruitment, you get a process of selection. So that selection day, now one egg they left for ovulate. So the estrogen now is responsible for the growth of the egg then they for me they reach a point called maturation, for me they mature. Because they just did no more as you get a primary egg, you get secondary egg, you get tertiary egg. So they did it as a secondary egg. So when the estrogen then they make them mature for come to the tertiary stage. So you get like sometimes you get more than 7, 8 eggs where they recruit. Then they select only one with ovulate. So in other words, if now one ovary, you ovulate this month here, the other thing, and the other ovary. So estrogen very important for that process day. Then when it comes to the other hormone they call progesterone, that hormone they actually help for prepare the uterus. Because any phase of human cycle is like they can't get belly. That's really the body system they settle. So what thing they prepare the uterus. We talk about the lining, eh?
Yeah.
They prepare that lining, they fine. In anticipation, say, well, go can score or belly can happen. So that hormone they say it relax uterus. So what can make woman mess is because when pregnancy don't happen at all, that progesterone they go down. So when it go down, there is shedding of the lining and they tell woman the same period. So those two hormones are very, very important for a woman.
Okay.
For in process of the menses and for form the egg then to maturation.
Alright. So like now you don't feel so as a gynae, what's in some of the common reproductive health issues the way you can see with woman there? Woman can count and you feel like it's so common among human there.
Well, infertility now one common something within the eyes. The other thing we can see more, but we can see more infection. Infection. Of course, not saying fibroid. Then you can say I get growth. Okay. What they can call growth. It's so common in woman there. So those are the most common things you see. Sometimes you can't say, doctor, never. Doctor, they get this discharge here, we don't want me too much. Doctor, they feel something they heavy in my belly, I not get belly. The most time we check out the thing a fibroid they get.
How this fibroid thing they work so? What is it? Now it's
well, fibroid basically not just a growth. Okay. Now the cells inside the uterus can just go and multiply. For some reason, we don't really know what to make. But those two hormones we don't talk about estrogen and progesterone because the fibroid cell not just a uterine cell, they respond to her. And when they respond to her, then they grow. Because of that theory they don't show say it can happen to her. So, but it get different side the way they go. So, it can go outside the uterus, it could go inside the uterus, it could go inside the wall of the uterus. So, you get different side the way it could go. So, the one more we can about woman them for men not get belly, now the one to go inside the uterus.
Okay, when somebody gets a condition like that, it make it difficult for the person conceive.
Well, not necessarily means you don't go conceive. You go conceive, but it depends on the amount of fiber the way then they. You go get belly, but something and it depends. It's all like I sit down this chair so.
Okay.
So if the fiber don't sit down, then chair they are all. Who's the people who can't sit down now? Why not there for sit down? Or if you can't sit down, I catch the catch. When you sit down, when you catch, would I get the best sit down place? Now the person will sit down inside. So in some instances, then, not that you don't get better, it's possible. But if you get plenty fibroid inside that lining of the uterus, the conception, the pikin no go can implant there. So what can happen, you get miscarriage. In some situations, you can get better. But also, waiting they happen when you get plenty fibroid, it then they make them conducive for maybe even the picky way they inside that line they for make it fine.
Okay.
Because it is same vibration. Just like where you see like stone na sea. If you don't want to see stone na sea, the way when the wave they pass. Watch inside that stone they see any wave they. Then they see wave they. So now the same thing they happen when you get fibroid. So if the woman go into labor, it can go to call abnormal labor, dysfunctional labor. The uterus they contract fine. If it burns cell because the uterus they contract and shrink, it can get bleeding, what they call postpartum hemorrhage.
Okay, so since we don't begin to talk about born business now, we don't move to pregnancy. I know say as we go, we'll still go back because then things they are just so interconnected in a way. So I want for we talk about that a conversation around that retroverted uterus and anti-verted or so. So when they talk say the way the uterus the tilts backwards and way the tilts forward. I hear saying something and the way it be say it make sexual intercourse painful for a lady, for a woman, and it can sometimes be difficult for the woman they conceive. So I may share light on that day.
Okay, so when you talk about retroverted and antiverted,
Okay.
so the relationship actually with the cervix, because the uterus self in a woman,
Okay, the womb,
and not
right?
the womb, yes, so now womb.
Need for good. So what them? So need for
Alright, okay.
exactly.
Womb, thank you actually for reminding me. So the womb not the in up straight, oh. It's not in up straight in the woman. Now that make when woman tin up, you need to come out through the vagina. Because if you tin up straight, all the take the woman as we cough no more, the bulge can down. So the way it align especially in fact it flip backward. So it get an angle of inclination. It get angle where the uterus dey with the pelvis. So the retroverted simply is that the cervix is dey backward towards the anus part. The antiverted it point towards the front. You understand? So when it comes to you say it makes sex difficult, not really difficult, but it make conception difficult for some women there.
Okay.
You understand? So what did happen? Because most time the position of sex is that man they on top of woman. So if you get a cervix where don't protrude towards the anus, and the man in penis they penetrate through the vagina and release sperm, in the anticipation say the cervix get old. That the more they for go inside, you get old. So now they the sperm for travel go inside. But then the old not point where the man only on top, it point towards the anus. So you can find out say, even when the man release, the sperm just stay within the vagina. It not get any way for go inside the cervix. It can't just make it painful, but it make conception when woman get belly painful. Yes. So that's why if you go to your doctor, you say, hey, me and able get belly, then get for do specular examination. Not just test normal for going on test there, but simple specular examination for able for tell you. Because few patients then they when they tell them for change their sex position, they get belly.
Okay.
So now that on that retroverted uterus. The antiverted now the normal way down the uterus for this.
So also one common.
Nah, antiverted ain't common. Retroverted not to just come on something. But it can happen even where you begin normal antiverted uterus. So until you get some pelvic mass, until you get fibroid, where they press the uterus backward. So it can make your cervix, in other words, retroverted rather than antiverted.
All right. Okay, I understand that now. And I hope say the viewers themselves then they don't clear in a way. So when I talk about painful intercourse, I hear about a condition where I feel like now it's so common because a lot of people then they come out and talk about them.
Okay.
The whole thing around vaginismus. Right. So when I don't talk about don't talk about this whole uterus tilted backward and forward, we talk about this painful sex and all. This so many people and they talk about and saying a very concerning issue. So now, like you as a guy, I feel like now you're the right person. We're able to talk more now. So I just want to you shed light on that there as well.
Okay, so yes, painful intercourse and something can happen, but then a reason. So you get the one basically it's just like tightening of the vagina get muscles then.
Sure.
So those muscles could just tighten normal in a way. So when there is intromission or penetration of the penis, you want to feel that because they need for relax. You understand? So, but then also, notwithstanding, not because of that tense muscle of the vaginal wall, then You get other things that can happen. For instance, sometimes you don't undergo some, female genital mutilation.
Okay, FGM.
In a way that, they don't remove the labia majora. They don't remove the labia minora. What did they happen? You get fibrous tissue. It they heal, but the so foot, the wound, they did the scar.
Okay.
So they make the opening of the vagina so tight. So you can imagine with that tight opening there, and then some problems will tell you, man, you don't know how in penis day.
Sure.
And then anytime they go, they try to penetrate you, you don't get pain. That can be one reason. You can always see sometimes a reason, sometimes you get some other problem within the lip of the vagina. Because I don't see few man can get to call battling cyst.
What's in that?
When a cyst when they come up by the labia minora, instead of as you start, I see you get two lip, you get the inner lip, you get the outer lip. So that inner lip there, you get to what they call battling gland. That battling gland there, now you open where they release mucus. So that mucus they basically help for lubricate the vagina. Because the vagina not just all the things the vagina gets small lubricant. Because you get cells and they where they pull some lubricant where they make it so smooth and nice.
Okay, but this vaginismus what they talk about now condition, right?
Yes, now condition where they affect some woman.
Okay, so now then they are try for like we talk more on like how person they even know say you get in the first place.
Well,
because if we don't talk about FGM, saying one of the factors that we can make that opening linking tight. For somebody now we not go through that whole FGM process there, but still they experience that whole vagina tightening issue there. So now that make her say like little to light on that whole vaginismus stuff.
Okay. So, you go know anytime you undergo sex, you go find out say it's painful. Because there is just tense of the muscles within the vagina wall.
Is it cure?
Well, it can be cured. It can be cured. Where they go do one, they will give medications and then probably go educate the husband also. So that at least probably you could use lubricant for ease them. Till the thing pass off. But at times, it's not just only the vaginismus, but there's an underlying problem we need to be solved. Where they see a vaginismus. As I don't mention some.
Yeah.
So once they get it off and then it will be fine. Because when you get battling cyst, what they talk about, of course, when you want penetrate, they get pain. You understand? It's natural.
Okay.
Say the tone of the vagina, they increase. So you will get that spike pain there. So that needs to be solved. But other thing they also they inside. We also can present in that form there, but where you don't know.
You go diagnose yourself wrongly.
Wrongly.
Yeah.
So sometimes you get cervicitis, inflammation of the cervix, or you get PID.
One day. Very complex. A whole lot, my God. Please, like the conversation just they get interesting. And viewers, them if you not get any questions and comments, you not just drop them na any platform now they watch you and just drop and we go make sure say the doctor responds to them. So let's just continue the conversation, you know.
So before you go down and say vaginismus, go first my doctor see you.
Yeah, because
then they rule out other conditions that we know.
Yeah, because some people then they say when the one way the battle with away, I don't see don't come out and talk about and say it can even get something for do their mental health, like it's chaotic.
Because anytime you want to go for get sexual intercourse, in the beginning get like post-traumatic stress disorder.
Okay.
They say, me today.
Oh.
You understand? So it's something basically also you get for cancer the husband, put them together so that the husband will be loving and understand the problem of human. But as I can say, don't just diagnose yourself.
Yeah.
You go better make a health professional actually see you and rule out other conditions before you can say now you get. Wait until you get.
So okay, just mention say that because of the thought. So now that they make them can say connect with the person in mental health because you always feel like the past experience now can get back.
Exactly. I go feel.
Wow, it's too much, but it's okay. Oh my God. Okay, so another thing I want we talk about now PCOS. Okay, so insef now a whole lot now something I feel like young people are now more than they come out, they talk about stuff like that and they are now it torments their life self in a way. So yeah, I will talk about that day.
Well, PCOS, as is the name, is a polycystic ovarian syndrome. So actually, na hormonal derangement, or they call it endocrinological problem. Well, I don't know how to break it down. All right, more say na hormone.
Oh my
yeah?
God.
Na hormone problem, hormonal imbalance. Let's just put that so. You understand?
Yeah, hormonal imbalance.
So now hormonal imbalance can happen to a woman. You understand? We start for mention some hormone them. What I one day will not mention. So we mentioned estrogen. Will be begin. Not so. Other hormone they call androgen. Wait for day. Then at the start to be say you cycle basically your frequency will be between 21 to 38 days. So you get a clinical presentation for PCOS. Then you get hormonal presentation of PCOS. So the clinical one is that you get what we call prolong or delay period. Before you see period between 21 to 30 days, they see after 30 days. So when you begin sitting down and I want sign that one day. So until you mention they can every month, after every 2 months. So once you begin see that one day, when I want sign, but not to no more, not to PCOS no
all
more.
that thing and
All that thing and day.
Sure.
So, but another thing that we can see is that you will get a clinical feature or certain thing they come up by your body.
Okay.
So until you go see, Uma will not forget beards. You go get you will get abnormal ear good.
Okay.
Because Uma not forget ear take come towards the neighbor. You begin see they come towards the neighbor. Or it can be very eerie. But notwithstanding, people that they want a woman they want off, then family they eerie. So not just see somebody who eerie say you get PCOS.
Yeah, not just stay there for watch out for.
So, but if you begin notice some abnormal ear growth, it can be one sign that one day. Then if you begin get acne, facing clot, then come on, you face too much, woman. Then you can get some certain thing that they call, well, this one I don't know for book and down. Tag, skin tag. Then we call it acatosis nigricans. When you come out of the body, skin tag, plenty. Some people say come up and they say kiss out the body. You understand? So when you see all them things there, then you get for do laboratory test
for determine. Okay.
If you see a high level of estrogen, and then you see a high level of androgen, the male hormone, because woman say get the male hormone small, the androgen. But the androgen they for gear to call desire for sex, libido. But if it they above the normal range, then that could point to say maybe you get PCOS, but not to PCOS normal. You get other conditions then. When they be like, I don't want to call them, but they call them congenital adrenal hyperplasia.
Wow.
When a specific thing that now we think. So that one is so the PCOS now classical form. You get classical form of PCOS, then you get the non-classical form. You understand? Because even congenital adrenal hyperplasia, they also they go up. So you go they see say, hey, now PCOS not to PCOS you get. But if you mention they come after every 3 months, then you notice say they get acne.
So much, eh?
Yes. Then they get that something like skin.
Some people like even talk about bloating. Say 1 minute that they feel, or like not 1 minute per se. I'm just that they feel bloated. Yes, stuff like that.
Well, I not common, but you cannot say
you not go rule out.
You not go rule out, but you not common. Bloating basically na other condition we can see, but not in PCOS.
Okay.
But notwithstanding, PCOS day by class, day by type. So what I don't mention so. It not can be there for all patients. You get type A, type B, type C, type D.
Okay.
You understand? We not follow all the things I don't mention, but the PCOS did it.
All right. Okay. So, like I said, yes, if we not get question, comments, not just drop them. We go make sure say we read them. Yes. So, let me now talk about. Okay. So, woman they way like kinde in them 30s. Now that they are done year anyways. Most of them can say once they begin get to that age day, early or going into, or maybe in their mid 30s, then the urge, forget sex, it can like you say maybe in a hormonal change. I don't know if it common to every woman or a woman they way they within that age range they normal.
Well, libido, they call it libido. Desire forget sex.
Okay.
But for common by any woman, the only thing not common where you don't reach menopause. Because your hormone they go down drastically. Because then thing I don't talk about estrogen, progesterone, even the androgen also they play a role. They make hormone in a small amount. You understand? So I don't know why when you mentioned 30 years, but it's something that is common with anyone within the reproductive age group forget that one day. You know, except you get hormonal imbalance. But if the desire probably for the, it's not just common women with 30 years, a common.
I just that yes. Now somebody I don't see most people and say now when they get to that age they begin experience like when you say
The
libido,
desire.
like high libido.
Well, I don't know, but probably some hormonal influence go there. So I'm not going to cut right now because when you're young, your hormonal influence is like 16, 17, and your hormone is very active. When you carry age, your hormone they start to reduce, and even the amount of egg they start to reduce.
Okay.
So you for be more active within when you're young. But if it happen, then you don't know other factors. Then sometimes the person not be married before, and now you don't marry, they don't get man, and the man always just say interest. So that can be one way. You understand? But notwithstanding, also probably it can also be probably not just a natural mechanism where they happen. But not that it will just happen within 30 years. But if it happen, probably I see the doctor and just look out probably what it make. You might not just rule it out. Why? But reason go there. It might be basically sometimes external factors, but not merely hormonal factors. Something which you see, which you hear, or something I doing that time is somebody they want conceive. So they feel like not just because you mind the day you go one.
Sure.
So that can happen.
Okay. So where we the talk, you say the things that we mentioned, we one can out more, we common infertility, infection. So like which kind infection? Because I believe say types then you know.
Yeah.
We so common we woman can count in cases them.
So if you look the human reproductive organ, you get the vulva, the outside part.
Yeah.
Then you get the vagina with a tubular structure. But most women them, so you get what to call, okay, let me just explain. You get what to call inflammation of the vagina, or what they call vaginitis. Then you get PID. Now two different things. Any woman has soon as they get discharged, it's I don't get infection. Not to all cases now infection. You understand? So, it could just be saying an inflammation of the vaginal wall. And somebody tell them when they will count, they will say, are they itch, are they scratch? Somebody say they scratch, they say, I don't get infection.
But not in all cases.
Yeah, so scratching, vaginal itching is not due to infection. And most times you go say that the man don't give me infection. No, it's just a change in the pH of the vagina.
Okay. That
So-
pH of the vagina.
Yes.
Because I hear you say pH balance and all.
Yeah, so the pH of the vagina for be a little bit acidic between 6, 7 in between.
Okay.
But what is the controller basically na the estrogen that hormone where the woman gets. So that estrogen is the presence of something where like I was okay glycogen. And they convert that glycogen to lactic acid where they keep the balance. And then 2, there is a bacteria inside the woman, non-pathogenic, not the way they give sickle. So that bacteria they can call it lactobacillus vaginalis. So that bacteria they help if other thing want. You just want to look, we get dog na use. Dog, where dog see you, they back for you. You know back for
That
you.
way na yawn.
You know, but fine. So in the day for protect you in case any bacteria carry you forget to eat that far. So what can happen in some women they do a lot of douching. They clean themselves.
Okay.
You understand? They clean themselves or some other form of activity they do. Keep predisposing for me then get that itching day. You understand? But not because of sexual intercourse. So they can just say the itch, the burn. But when you do a specular examination, you look the cervix fine. The cervix not red, nothing not one.
Okay.
Okay. So now purely no more abnormal discharge when they happen to them. So then can say an infection. So you don't need for begin abuse antibiotics for that. You just need for
Antibiotics, yeah.
You don't need for educate the person, and then probably you can give some persils and just take simple medication no more where they get it of that day. So the other infection are the PID. When they start from the cervix, and they go take a cam, and you don't discharge the different. The discharge when they come out is smell, is offensive, and then the woman in bottom leg go the heart. Sometimes they take the same period, na pain, they go get fever, at times it can lead to other problem. That one day, in bad.
Okay.
You understand? Because that one day when the woman gets herself, if you not treat her quick, it will go affect in tube. And when affecting tube for make the woman get better, it will be difficult.
Difficult.
So it's not that way woman can say they get discharged. Now just like now that type of infection I don't mention, this last one. So now just ordinary inflammation because of certain change in the pH of the vagina. Once it's solved, the problem don't solve.
Okay. All right. So, like now, social media, TikTok, you go see a lot of products that we people in the sell. Talk say, okay, can't buy these for tight the vagina tightening. Young people, yeah, and a lot of people can see. Some people can laugh. Some person go say, you don't need for try for put anything inside that space there. That space then aside where they say self-cleaning. Some people they say I get something for self for clean day for make it smell like rose and stuff like that. So this now to say if that particular side you get certain products for they close, like how somebody can go one time.
Well,
I don't know.
medically, I don't know of any product
For closer.
They close. You understand? Because first of all, when a woman are engaged in sexual activity, the vagina they still you will find out the elasticity of the vagina. In the lossa, they begin to come together. Okay. As you begin sex, it begin because you get the squamous epithelial elastic, it stretch. You understand? So those products they use for put the in fact it will cause for you may get vaginitis. Okay. But there are medical conditions that also where they can do they call them vaginoplasty, where they can do vaginal tightening. In case until the woman be done born, it get big tear. You understand? In short way that. It can feel very uncomfortable when they get sex with the man. You know, some man can don't use some more than. I know
No, yeah.
So where you go, you can do what you call, you can do that repair for him, perinography, you repair and fine for him in a way. But notwithstanding, yes, some people then they go still do vaginal tightening because sometimes they want me to meet them probably virgin.
That's not where they walk. Nah, a thing.
Well, you go do vaginal tightening. Now you go just get some tissue you close.
Okay.
So when you go, you make the place tight, you penetrate, which says, oh, I'm meat and this. You understand? But those products, they might be working, but medically, you know, advise somebody go begin put products, then you go get serious PID, then you go get serious vaginitis. So I don't go advise that one day.
And what about the one where they buy stuff there for say go for cleansing and this and you know?
It's not fine for douching. The vagina they clean itself because again mucus secreting cells. First of all, when they say me all the time, I don't know till they come up on me. The vagina is so God maker.
Yeah.
If for the secrete, if the only time if they what they secrete is offensive, you understand? It be look yellow, it look reddish, it look brown.
It look abnormal.
Fine, now you go begin worry. But each self, whether the man if ever get belly self, they get a lot of discharge.
Okay.
Not an infection. You're not missing an infection. That's the way it is. The vagina is never quiet. So all it takes is secret because now so if I walk.
All right. So I think some people then send questions that we will just look at. So I think this person is say pap smear should be done every 3 years to rule ovarian cancer.
No, not ovarian cancer. Now cervical cancer you do it for. Now for screening of cervical cancer. Yes, so you can do it every 3 years.
So a mistake
not a mistake, not ovarian cancer.
Yeah, okay. So this person say, how does a woman manage blocked fallopian tubes due to fluid idosalpinx?
All right. So idosalpinx basically an abnormal accumulation of fluid within the fallopian tube.
Okay.
The fallopian tube basically is a part of the womb, and on that side there, where my mind that they meet up, now the fertilization they take place.
Okay.
So if they block, the egg from the ovary, they able to move can through. It just follow we don't block gutter. So then can do for you tuboplasty. You understand? Where they open them to something they call laparoscopy or hysteroscopy. You understand? But also it depends on what thing they do. Because you can get inflammation of the tube. Sometimes in a pus they do. Imagine you go do tuboplasty, you open, then the pus go inside the woman belly. It cause sepsis. So what is being done nowadays? It can work. They can even they call that thing about what they call phalloplasty, when they can try to open the fallopian tube. But nowadays, what they encourage where you don't get blocked tubes, where the tube then block. If really the diagnosis and say block, because at times you can go do HSG, that investigation for me to say the tube then not block. But because of spasm, because of the pain, the tube just make like a close. It not close in a way. But if truly proven, say it close, then we can advise you to go do IVF. Because if you open that tube yourself, the tendency to make you get ectopic pregnancy could be high. Because the tube gets certain tissues then, where they call ciliated. If you know like where they plant rest, you see where the rest can move, please they come. So you get then small tissue that they within that tube where they help for with the move the PK way don't form for calm the uterus. So even when you do and you don't get problem, you will just get ectopic pregnancy. So even if they open and safe, and not keep be 100% certain say you will conceive. You will conceive, but it will be ectopic.
It will be difficult.
Yes. So you can just advise say, well, go do IVF.
Okay, so that first one are from Emily and Dorothy. This one we just respond to now from Samantha Aisha Mansari. So this one, St. Joseph's Library Club, the person say, what is the repercussion of having sex regularly? Is there a repercussion?
Well, it depends on, first of all, it depends on your health. Sex is something physical. You get a lot of calorie for burn. You understand? So it depends back now, what that they do. You understand? If you want to be promiscuous, then the risk for me get infection could be high.
Sure.
HIV day, hepatitis day, syphilis day. But if you not marry somebody, you get your man, and you know they try for conceive or for get pikin, we can advise you get regular sexual intercourse at least 4 times inside the week, 1 in, 1 out. So that one is done in a way basically one at the planner. But for say you do one every day, it depends. At a particular time we ovulate, you go say do one. But other than that, for just to do one all the time, well, it gets some part of effect we could do for your health. But notwithstanding, sex is fine. It improve blood flow. It improve a lot of things. It even make you think. It improve your immune system. But to do it every day, it not go too far. It will get your health as I will cause fire.
Yeah.
Because too much of one thing is good for nothing.
Yeah. Okay, so since this person they asked a question about regular sex, what about sex toys then? For woman, they're like different because some people can say maybe when they use this since the charger, it will cause cancer, it will cause this. I don't know, sometimes a myth or people can just want for.
So they call them protector.
The sex toys then.
Yes, call them protector. So when you go get infection because people use it a lot, yes. But also in certain conditions, then they will wait until the woman get vaginal tightening or get a vaginal pouch. You know, so not to all women get vaginal. Some of the born the vaginal pouch is almost close.
Okay.
You understand? Because it can get some amount of closure upside. So you can use a sex toy there, but where they use basically for help for dilate. You understand? But as you say, people can use them because probably, I don't know, the man or not near them. Or for some reason.
Yeah, for fun.
Yes,
because
for fun.
of course it's not about the man safe. They're
So
just these and
you put yourself basically forget infection. Because you don't know how you do them, the hygiene, how you take them, how you do them. But I don't see really something where, well, I'm not going to say bad, I'm not going to say not bad. But I think say the organ where they make for sex, not the penis.
Yeah.
So anything other than that, probably get repercussion or to the cause.
Okay, what about the one that because I guess some people can say if somebody constantly they use sex toys, well maybe when the person grow old, it go get stroke, you know. I don't see something like that there. So the person go get stroke. Yeah. I don't know if that is a true on a myth.
That is a myth number one. No, I don't see that one.
Okay.
Then the other thing basically back, if you use sex toy, you know, I don't know the size because they by size. I know say protector they by size. Let's assume you don't marry it, you use sex toy. And then you go married to a man away in penis, not in the sex toy. So you find out you begin to get some issue. Because what is made is that the vagina for grip the penis in most instances, even not 100%, but in a way. And you don't use sex toy in such a way that the elasticity of the vagina will not too open. So you find out you get problem for satisfaction. So that will begin the issue between you man. And then you will go back to the sex toy. Then you might go see one day now. You see now this is deeper. And then a lot of issue come about. So you have to very be careful to use those things. Because they also get their own side effects.
Okay.
You know, and then get a young other social something back where it could get, on you.
All right. So, okay, let's just take this. I will ask a question around masturbation, but I see this person, Samantha Aisha Mansare, don't say, is female masturbation dangerous to oneself? Masturbation, where woman do all, is it dangerous?
Well, first of all, I don't go on. Well, I come to the money first because studies also say women who regularly masturbate, it help for prevent prostate cancer. But that's not 100% it is.
Correct,
You understand? There are other things that we can do. Pelvic exercise for increased blood flow na the pelvic, na the prostate. But also if you get you regular sex, maybe 14 times inside a month, it can help. So masturbation, basically, I don't know.
So,
I don't know.
That is like the medical aspect because
I don't know which satisfaction the person they get in masturbation,
okay,
whether man or woman.
Okay.
Because why? The vagina is a tissue organ. The penis is muscular way to erect.
Okay.
And so that friction between the penis and the vagina is what makes sex pleasurable. There is nothing to duplicate. We can take that one day.
Even with the dildos, like the sex toys, they're not going to match the same.
Well, I'm telling you, not much. Because the vaginal tissue, it is what it is. It no matter.
Right.
You get that just desire normal because you get that libido. But what you get in the vagina is far different than we could get from sex toy. Even the man say when you begin to masturbate, it's not the same with the vaginal tissue. Because the vaginal tissue itself, the way God make it quite different.
Yeah.
You understand? So whichever, the pleasure cannot go be the same.
Okay, sure.
You
Okay,
know?
I think that's clear now. They say whichever, the way God creates, now don't create that way. The whatever we use, it not go be the same. So Samantha Aisha Mansare say again, how important is a tight vagina in sex?
Well, well, of course, it's important because maybe a lot of men want tight vagina.
Okay.
You understand? But the vagina will be for be the same.
Yeah.
You understand? When you start a sexual intercourse, as you go along, even though it is tight initially, but because the vagina they increase a lot of mucus secretion, the lubricator, you find out say the laxity they go down along the long way. You understand? So it depends on who they get regular sex with. You understand? Whether they get regular sex with. But along the line, basically, it get for be lax, it get for lax.
Okay.
But it's good if you have a tight vagina. That doesn't mean you go one go do and for tighten and all. Because it increase the friction between the muscular penis and the vaginal tissue.
Okay.
Because that's the act that makes it pleasurable. You understand? So it can bring a sense of satisfaction into both couples. You understand? So maybe in that terms where they say, fine for me, but it don't mean say it will ever remain for me tight. Yes.
Right.
Because what makes sex pleasurable is not just tight vagina. So let's take it out of the context of medicine. It has to be with the love. If you not love somebody, unless they get tight vagina, there's nothing you can get.
Exactly.
You understand? So not just put a number on tight vagina, but also the context behind it. You understand? When they do them, is their love. If love not there, there is nothing pleasurable.
The tightness not going to even matter.
It don't matter.
Right. We
You
get
don't
that.
go down for the commodity.
Okay.
But it doesn't really look at anything.
Okay, so now let's talk about oral sex. But lots of people can talk a nice, like you say, nice, it's fine, it's enjoyable, they make somebody and in partner go get a very lovely time. But medically, some people can say it get chances for cause infection by the woman and even by the man as well. Whosoever way they do and pine compy. So why may we talk about that? Let's talk about oral sex.
So oral sex, basically, the context I come about, let me just explain it. The tissue in the mouth.
Sorry, excuse me. Oral sex as in giving head. Yeah.
All right.
Because they will just like try for make
Okay.
it out. Yeah.
Okay, I don't know, jaw, whatever. You understand?
Yeah.
So the tissue in the vagina, the tissue in the anus, the tissue in the vagina, they are squamous epithelial tissue.
What's that? What's in that name?
Now the same tissue there.
Okay.
You understand? But the one at the vagina is what actually made for sex because it absorbs absorb or they allowed the sperm for go out after sex. So when it comes to oral sex, well, it depends what the person want. I want to be very careful here.
Yeah.
People go answer and say, well, I really want time. You understand? But the disadvantage here is with oral sex, let's assume you do oral sex, then the person get HIV. Because sex is not something physical. Do any sex where the sex a woman, man a woman, there's always a boosting that take place. Minor one we never go see. And assume say this person get HIV.
Yeah.
Then you do a sex with her. And you get small cut. You don't get HIV.
Yeah.
Or you get hepatitis. Or third is also say it cause laryngeal cancer.
Oral sex.
Yes, cancer of the throat. Yeah.
Not enough for like the man or the woman.
Well, whichever way now I go.
Okay.
Because oral sex is not just one way.
Yeah,
It's both way.
Sure.
You understand? So if the partner gets infection, you go to suffer. If you start also say, then you get all that thing like human papilloma virus. What? Vaginal what we can come up per woman, even per man. Then they go sucker. A highly contagious, you will just get them all over your throat, and that will kill you. Yes, it will kill you.
Oh.
So, and then notwithstanding, you know sometimes the person where you do oral sexual, they get TB. So woman can get TB.
Tuberculosis.
Yeah, tuberculosis.
Oh.
Tuberculosis of the pelvis.
Okay, then the day.
Yes. So it cause blocked tube.
Okay.
Then after you don't, because it's not only basically doing the oral sex, after that it will go back do intermission inside the vagina. So by so doing, you take the non-pathogenic or the bacteria with the one side, you can't go the other side.
Yeah.
So that is the issue with it. You understand? But obviously, people then get various ways.
Yeah, because there are people that they will tell you say if they not get oral sex with them partner, they're not gonna be comfortable.
Well, there are complications.
Any types they do, there are consequences. Yes. So the doctor don't shed light on the disadvantages of them.
There are complications. Sometimes the man get small human papilloma virus at the penis.
Okay.
Then you go just get in penis. Then you go get. You factor that thing and they say we you see like lesion in the mouth. They say I get cold sore. Some of those cold sore basically you they get on 2 kiss, you get on 2 oral sex.
So not 2 fever. Yourself, Huh? So not fever.
Yeah, that's what it be. So they
no, what they say is that some saw the way they see na pussy mouth na fever. Like
yeah, fever. Some not a fever. Some na HSV. Happy simplex virus. 2 oral sex. Yes.
So you know, see some no na pussy mouth you feel say na 2 sex. So suddenly if pussy don't sick, serious cold, whether cold day or malaria or typhoid, the left eye go get fever in a month.
Yeah, so we see the fever cold.
No, you go feel now say this. The doctor be don't say.
Yeah.
No.
So it can be herpes because herpes they come out from the mouth, they come out at the vagina. It they come out per man self.
Okay, let you not misunderstand myself, please. Yeah. Yeah, because some pussy go sick, then when that sick day the left eye go actually get cold, then now. We don't say this on possible. Where you go see that person, they go say, "Oh, this not that reason the cold safe." Yeah, because
but actually, under fever say they give you those lesions at the mouth. So not to those who are sex, but so people they know that one.
Nah, no put out there.
If you get serious fever,
please.
Yes, they give you back.
All right, nice. Yeah. Okay, so let me talk about contraceptives. Okay, so now. First, and I feel like people then be even they shy away from things like that. But now it's open. People they go to pharmacy, young people that they get But is there like side effects for long term using contraceptive?
Yes, side effect day.
Okay.
Contraceptive is not 100% perfect for say we take and don't get better.
Okay.
Because if you not take and wait for take the time we for take you not take regularly. You understand? It go fail. Then you say the contraceptive don't fail. You understand? So 1, you get better. Then 2, it depends on how long you don't use them. And which kind of medical condition we get with the use them. So it don't mean say because contraceptive day, you just go take them. So you get to call medical eligibility criteria. Criteria day before you start contraceptive. based on your medical history. If you not somebody who get sickle cell, for go begin take that contraceptive they drink and not fine.
Any one way they drink?
Yeah, that one way they drink every day.
They're not fine.
They're not go fine because it will lead to some problem for you. Where they lead to clot them for form. Then it depends on if you're not a smoker. It depends on your age. It will depend also on your history. If you get family history of cancer, like breast cancer. So it's not that they'll just take and also. So the issue of taking contraceptive, we will talk about them, but it will be fine before you take them because contraceptive is not just only used for prevent belly.
Okay.
They use it also for treat some abnormal menses. So we'll talk about. If you get hormonal problem, you need to see period like peacocks. We can put on contraceptives so they're going to see period regularly. And it will cause balance in your hormone, make it look fine.
All right. So let's ask this way you don't talk about this. So if somebody go to hospital for a want for the part of a particular family planning, that the medical practitioner then you like test the person condition, ask and say you get like we don't mention the sickle cell. You get this so
Yes,
before then give you a prescribed contraceptive.
Yes, they ask.
Okay.
So by right, not only asking, but they do pap smear.
Okay.
Because pap smear they use them for screening. If you get probably lesions then because cervical cancer they go from grade, they get grade where they go. You get some with the tissue, they see lesion they before it form cancer itself. So if we watch semen or not give or contraceptive, they can do even liver function test for see liver all fine. They can even do scan for look your liver. Because some of the side effects then can cause small problem at the liver. So it's not that because you say you want contraceptive, they just they give you no more. But they get for look at all the factors they have for you. History, you smoke, you get diabetes, you get pressure, you get family history of cancer, then go give the appropriate one where you need for get. So it's not just only there for woman want prevent belly, it's also for prevent certain condition. You understand? Because some of the contraceptive then they prevent ovarian cancer. Then they prevent endometrial cancer. But then too, I say they prevent, but some way you take, it lead to cervical cancer. In the long run, or probably you get lesion at the cervix. Then they take this over contraceptive, they take her, they take her, they check. You understand? So they predispose you to her. Or they get family history of breast cancer. You don't they take her, they take her, and they predispose you for semen the cancer, go to another stage. So all them things then get for look at her. But if not short time you use them, you understand? Then go put you on the short term, then they will do them back. That not going to lead to any complication. But if not long time you use her, let me say 3 years, 4 years, then they get for they do regular check on you. For final say, then risk factor you not get her, for me not get cancer.
What about person when not go through that then procedure then before even get them pills and the deal?
Well, maybe something that just short term, they take them for.
Okay.
Notwithstanding. Because mind you, waiting the recommendation is say, you understand? That like let's assume say woman don't born, they don't born 5 pikin. You understand? It is far away, outside, all the facility are not there. And this woman, anything a man get that they get belly. In that short time, you will prefer for GM than this woman die of what? PPH or die of complication of pregnancy. So again, for short time, you will do her.
Wow.
In the sense. But really, if they take them, they need for the regularly they check and see those risk factors if you're not there.
Okay. So what about still on contraceptives? What about people that where they take like emergency pills every day, like these eye pills where they say? So since they can say since the emergency pill, not also something where for they take every single day, not just like 10 day, maybe you get sex and you need they on any kind of protection, you just want for use. And some people can say by right if you take a like for 3 days, I don't know that back if now myth. 72 hours or 3 days
If you
is
take
still
her
in
within
your body.
72 hours after the sex.
Yeah. And if you don't take her, it dey like 3 days, it will still do like 3 days in your body or so. I don't know how true is that.
Well, basically, you for take her within 72 hours.
Okay.
You see, because I think it's in the context of the process of implantation, division of cells, them where woman don't conceive, not doing anything they take. So once they within the system, then they prevent that procedure from happen. So, but like, it's not something you would take any nowadays.
Yeah, because some person will say, me whenever they go get sex, now yeah, they take.
Let's assume say you do at 60, one take at 60.
Yeah.
There is a problem there. It will cause hormonal imbalance. You period they come, you will find out say poop, it will seize your period. Then you will find out say you get abnormal menses. If you foresee period, the 28, you can't see after 2 months. You understand? So it can cause that problem there. Because few patients that I don't see them when they tell me, say, I go take IP, the doctor, and medicine they can. So the first thing they do now for do pregnancy test first and see. Because you trust nobody, do pregnancy test first. Once you don't rule out, then you hear medication for making same period. Or you can just assure and say, relax. But some women always can worry. Because women want same period, especially women within the reproductive age group. So you can advise them or give medication then. And then they call it medication. So that people don't go buy and misuse them. Exactly. And then create problems. So that's why I'm not calling it medication. So they will get medication then. It goes in period. But it's not something should be taken every now and then. At least twice in a month.
You see?
Yes.
Twice in a month. Okay. So what about people who can say contraceptives then they make a woman fertile? I know you possibly don't say if you day on a particular contraceptive, when you stop for taker, it make you as a woman very fertile, and when you stop, it will make you able for conceive quick.
Yes, it can cause that.
All the types or
well, not all the types.
Okay.
Because something they like the Depo-Provera where they take every 3 months.
Okay.
It sees ovulation for quite a long time. So you can stop and say you can find out say 1 year, 2 years, and get better. Now so they work because the medicine get for the inside system. The combined with contraceptive where they take that tablet they take every day. So some people then, especially when we talk about polycystic ovarian syndrome, what they regulate your hormone system, that abnormal hormone or the regulator. So as you can stop and you get better. You understand? Then always even people don't get polycystic ovarian syndrome. For some reason, when they just take a normal, when they stop, for some reason they get better. Because mind you, the way the hormone they work is that like you get money in a bank. Let's assume you get 20 million in a bank. Then every day they can't give 1 million. You go take your money in a bank. You don't go take her. You dey keep her. You understand? You only use them when I stop for you. You understand? So it's the same process. Once you take that hormone pill, then they inhibit your hormones them for work. The one that we get naturally for work for me mess. So in other words, they just did no more, they go. So once you stop that surgeon stop when you stop, then say they come on, it can just create the woman get better. Provided you not get other medical conditions then. Provided you not get blocked tube. They gonna go get blocked tube and say, "Well, take this one, I will make her get better." No, you don't get better. You understand?
Yeah.
So it can happen in most women.
All right, that's clear. Okay, so in the spirit of still taking messages, since we don't shed light on oral sex, I see this person Usman Koroma they say, "Tell me about men who are used to licking the vagina, licking pussy." I don't know if someone gets used to that, but we don't know what he go say to her.
Well, that one of the reasons that woman is someone they get vaginitis. You understand when they get inflammation because what did happen? You are going to lick all the natural bacteria we give for protect the woman. So by the time you take the one in and the mouth can't go sign off for day, you find out say inflammation will take place.
Wow.
It's a sexual act people they get different way.
Yeah.
I'm not kind of can't condemn people.
No, sure.
But just to tell you that
here.
some of the things then basically it gets any repercussion they do. Let's assume somebody gets some papilloma.
Like
you know see yes, woman or vagina what?
You go lick her,
You go lick them. Then just few times begin to see some lesion they come out in mouth. So you have to be very careful.
Okay.
What you do.
So yes, Mister, una please people, una need to be very careful. So let me talk about now. I think we don't touch a whole lot now the female reproductive aspect self. So now menopause. Because me growing up, people can say now like women they in their 50s, they begin experience things like that in their 40s, but now there are instances where somebody they say even in their 30s.
Well, actually, it's not. We don't call it menopause. We call it primary ovarian insufficiency.
Okay.
You understand? But menopause basically start around 45, averaging at 50 years. You know, if you don't go into menopause as a woman. So anything below that person need to be investigated. As you can say, it might not be menopause, it might be some abnormal hormonal problem. The thyroid can be one problem. We can make woman not in period. Breast secretion. We woman not get belly, but what are they coming about? They inhibit those hormones for make you mess. So you go they say I don't go into menopause, but notwithstanding, in Bobby they pull water. Notwithstanding, in thyroid gets some abnormality. So it might not be menopause, but you have to do a test for proven or it can be sometimes now some condition in there where some antibodies in the body, they affect the ovary where for produces hormone. So they make the woman at that young age, and then they see period again, like now menopause. But when you talk about menopause, there are things and signs you should see.
Okay.
Hot flushes now one.
What?
Hot flushes.
What's
You
in-
don't just no more. You begin to sweat. You feel
Okay,
bad.
heat.
Heat, yes, fine, good. Then decrease in libido. You don't get desire for sex.
Okay.
Then there is what cessation of menses for 1 year, completely. Then other thing they like what they feel called genitourinary syndrome of menopause. Then dryness. We they talk say, woman all the time forget discharge, small thing
Yeah.
they come on. As you give menopause,
The cut.
they cut straight away. Bone pain. They can get bone pain, yes, bone pain. So the tendency for make you get fracture can be high.
Okay.
Then the tendency for make a urinary tract infection very high.
Oh.
Yes, you know they got a vague symptoms them what can happen, we can get.
Okay, you just say where woman day in that phase and that menopause phase, the libido the low.
Yeah,
I recall one thing where I just like I can say the body then they different. Waiting they work for another person or go work for
yeah,
you. So a woman in 50s, if they talk about in experience during this menopause phase, yeah. And it talks say where they reach this menopause phase. Now that time they a libido, I say always they feel horny. That they say a woman in the 50s, they go through that phase there. And you also talk about memory loss. So since you said the libido, it calm down, it decrease.
yes,
Well, in your own, it say it always they feel horny. Talk about these heats as well we just mentioned. So yeah.
So when you call it symptoms, not mean say all intended for work one time for everybody.
Right.
You can get 2 or 3.
Oh, now for let we just like
Yes.
lay clear to people.
So
then.
notwithstanding, the ovary not to the only organ where they produce hormone for the woman. Your kidney, certain area they by your kidney where they produce hormone there also. You understand? So it can be say they get production from that side there. And once you get androgen go up, then you can get the desire. Yes. So a young can be just special case.
Yeah.
But with time, basically, everything just go down. You understand? So even when they say 50, some man, they, not to 50 years, they get menopause. Some man, they go to 55 before menses cease. You understand? But one of the things that we foresee in menopause is that you they miss period for 1 full year. You don't see period at all. And we then see to that I don't put. Not necessarily mean say hot flesh go call, all everything go call, but 1 or 2 of them go call in the presence of waiting where you know they see menses. Those are the clinical things that we see. But if you want prove them, then you have to do laboratory investigations. You go find out say then hormone they are, where be they come, they all don't go down. Now that you go see, we go show. But some woman they 55 say before the menses stop. A variation day,
Yeah.
you know. But averagely most women 50 years, the men's don't cease completely. But anybody who is seeing period, not the same period below 40 years, is not menopause. It's primary ovarian insufficiency.
All
When
right.
for need for investigate and see what the cause are.
Exactly. Okay, makes so much sense. So we don't talk. I feel like we don't even touch around. I will still check if there are messages. But like you as a male gynae, you can get challenges with female patients. Maybe
Yeah,
woman they will
yeah.
say they not feel comfortable for talk to
Yes.
you. Okay.
Some can feel not comfortable for talk to you. You understand? Because why they say as now man, but woman with himself. You understand? So what you can do in that situation, then you get female gynae with them very good. You can call one of them, okay, can't see this patient. You understand? But in some instances, if you educate the woman, I don't get patient the way I don't see because of religion background.
Yeah.
He deny, say no, doctor, not go see me. But when I explain here and the process, take me to explain here, say no, doctor, examine me. If I don't answer, I go operate myself. Yes. So in those situations, and they probably because of they feel maybe not experience, you always need to examine the woman without you not get a chaperone. Somebody for the not woman will see. But some of the patients that I say, no, doctor, no, that woman come and see me. It's the just that examine me. So if that trust not there, that's why you get always a trust with your patient. But notwithstanding, like standard practice, so they go oversee, and outside laws, they sue people. If you not examine somebody, they go just say that person don't go try for do some kind church me somewhere and all like, you know. But that can happen. But in some instances, I will call my colleague and say, doctor, can I examine this patient? Because you hold and forgive care. So you're not going to take a personal vex and what yourself. But if you talk to the patient, you really explain it and fine.
I go
You
understand.
understand. And you can do examination and get the finding.
Right. I feel like reproductive health discussions are very key. In a way, picking them for begin learn at a very early age.
Yeah.
Yeah.
For nobody helped.
How them body they work.
Yeah, you need for know.
Mm-hmm.
So I think it can start at the home, not merely basically at the school.
Sure.
Because I think my mother also for educate them, especially when they begin same period for talk to her. What are the things that happen? What are the do's, what are the don't? It's very good for her, for her upbringing. Even at that age of 13, begin to talk to her.
Okay, yeah, very, as you say, from the home, schools, very key, because if a person understanding body, even girl because at an early age, because some of them parents themselves they shy away for talk to them about some of them things.
Yeah.
So picking away going to school now begin get certain information.
Exactly.
So if they're not able to get the right channel for get the information they are, can mislead them.
Yeah, exactly.
So it's very important. So we don't clearly talk about a whole lot. Yeah, so I want little just because there are a whole lot of things that we don't mention. Left with viewers them before we say bye-bye to themselves. Test the way woman they need for the prioritize for going to hospital for. Young woman then too. Yeah.
Well, I don't want to say specific. It depends on what they desire and what they do to them.
Okay.
Understand? Because some woman they will tell you not to infection get in a body one bone.
Okay.
So if you know woman about scaling, you don't date your man. Let me say for 1 year, because infertility basically is a regular sexual intercourse without any barrier method or whatever you use for men to get better. So if you did 1 year, you not get that better day, then you will need to go and investigate based on what you present with. But teenagers are basically what teenagers can get basically, a trach infection, sexually transmitted disease is very common. Because as you say, they're not too educated. So they can do practices them because of peer pressure. So most of the things PID common for them. It's very common for me to get PID, very common for me to get urinary tract infection. So once you get a teenager will go to you, say, doctor, I'm belly the heart. So make sure you screen them for sexually transmitted infection. Okay. Very important. So if there's somebody who probably based on the age, let me say about 40, can say, hey doctor, now this happened to me, they bleed. Then you get for investigator based on the age and what they present with. So it's not just date for general Elma Waker at the same test you go do.
Yeah,
so it depends on the age group.
Okay.
So that particular test you go do based on that age group there and get to the bottom line.
Okay, thank you. Oh my God. We don't get a very enlightening conversation. Even myself, I don't learn a lot, can't lie. Yeah, I don't learn a lot and it's thank you very much. So well for just left a message to the viewers then we don't watch advice or something just we go keep them more on their toes on issues that like this.
Yes. So viewers from the way that also the human reproductive system is very wonderful. The tendency of woman get infection is very high because the surface area of the vagina is wide. Unlike man, the surface area is small. So your health and something where you for prioritize. If you see they get discharge where a abnormal, a yellow, or a bloody, based on your age group, or you get severe pain, you get fever, then now something where you for take serious, not just go begin pepper doctor yourself. Exactly. If you don't do that, then go and see a gynecologist. We get government hospital all over, get private clinic. You go and see you, they evaluate you, fine, and treat you. So take your health serious because some of the infection they are, we'll mention what, that a risk factor for making get cervical cancer. Whether not sexually transmitted one or because that repeated one go give infection. And then if you know woman way probably you want conceive, you understand? Not just they go no more, they take all kind of medicine or listen to all kind of advice. Go to a professional, then they go investigate you and treat you appropriately. Or sometimes we talk about something that with antiviral to vital uterus. Something that you get. Yeah. Sometimes they just examine you. Then when you change the sex position, better go come. So now that's what we will say. Thank you.
All right, thank you very much. So viewers, they can't left for now, but yeah, the doctor that enlighten we are. I feel like we don't get knowledge about a whole lot of things. And as women there, we very delicate. We reproductive health, even with skin, everything about we are very sensitive human beings. So not all kinds of things we for the introduce in our body. We for be very cautious about the things that who they introduce to ourselves, and be very careful. Everything that the doctor don't say, like in say what thing go work for this person, not go work for this person. So everything depend on how your reproductive health stalik. So till another episode na Valentine say then at the technical room na bring this program cantona we clear in this way as I day. Mina Aja Sunkari say aka Aji till another episode. Thank you for watching and bye.
For the news we dey around, log into Liberty TV online. Positively we bring the change. They get the masses involved. Staff them everywhere, everywhere. We climb the mountain just to get the news. We go down the slums to get the views. Hi yeah, hey, voices come. Credibility, now we ability news, give you the views, the tell where you want them. Government issues, democracy, now we not the answer. We human them, girl picking, there's a get the power. The count on me, the count on me anyhow. Give you the news, give you the views, the tell where you want them. Government issues, democracy, now we not the answer. Human them, girl begin the secretary power. You can call on me, count on me anyhow. Liberty we ride, like a nigga we fly. Liberty TV day before. We climb the mountain just to get the news. Go down the slums to get the views. Hi yeah, voices down. Hi yeah, give the news, give the views, the tell where you want them. Government issues, democracy, now we not the answer. We human them, girl picking, there's a get the power. The count on me, the count on me anyhow. Give the news, give the views, the tell where you want them. Government issues, democracy, now we not the answer. We human them, girl begin, let's get the power. You can call on me, count on me anyhow.